I'm Dr. George Isham, co-chair of the Roundtable on Population Health Improvement at the National Academy of Medicine. I welcome everyone today to today's workshop, and especially our esteemed speakers. I'd like to thank our host, Dr. Kovarovich, and his colleagues at the New York University Medical Center for making this workshop possible. The meeting is being recorded and webcast, and I also welcome those of you who are joining us virtually from around the country. We will take questions and comments from the virtual audience as time permits, as well as obviously from the audience here in the said auditorium. I would point out that we were originally scheduled for a more appropriately sized room for what is a very good showing in terms of our workshop, but now at the last minute have a larger room. I'd like the speakers today to follow a protocol where you come down and come up this stairway to make your comments. And if you would sit close to the front of the auditorium, when we have the discussion period, you can come up and sit on the panel on that side. And for those of you in the room who are going to be asking questions, there are microphones down here at the head of each of the two aisles. So we're very grateful for the opportunity to be here in New York and to be here at NYU, and very appreciative of the generosity of hosting us here. Since February of 2013, the Roundtable has been providing a trusted venue for leaders from the public and private sectors to meet and discuss leverage points and opportunities arising from changes in the social and political environment for achieving better population health. The Roundtable's vision is of a strong, healthful, and productive society which cultivates human capital and equal opportunity. This vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require robust national and community-based policies and dependable resources to achieve it. So as one of our major activities, we hold workshops, such as this one, for members, stakeholders, and the public to discuss issues of importance related to improving the nation's health. In my view, there's no more critical point in time than these days to have these dialogues where we examine those factors that ought to be in place to provide better health for the nation. I would normally be joined in convening and hosting this workshop by my co-chair, Dr. Sandy Magnan. Unfortunately, she is unable to be with us because she's dealing with a death in the family, and instead of having her share those responsibilities with me, you are stuck with me. So I will do my best to do a reasonable job of making sure we're off to a good start and close appropriately. If you are tweeting, please use the hashtag #PopHealthRT as noted at the bottom of the agenda. If you have any logistical questions as the day unfolds, please talk to our staff at the registration table outside of the room. You will note that those of you who came in that way, that there are additional meeting materials available and out there at the table, and for those of you elsewhere in the country, excuse me, additional materials relating to this workshop will be posted to the meeting page afterwards. These will include the slides for many of the speakers, after a few days, archived workshop videos so that you can revisit some of the conversation and presentations, and eventually a written proceedings will be prepared after the workshop as well that allows access to this conversation through that means. So at this point, this is an important topic that we take on today, in my view, one that as a healthcare executive I've come to realize is more and more important over time. that of making sure that our children are well prepared for life. So I am now pleased to introduce Debbie Chang, and I understand Phyllis Meadows, who will be helping to overview the progress of this session, although Phyllis will join us much later in the proceedings. They will provide some background to today's exploration of the intersection between health and early childhood care and education, and I wish to thank them in advance for doing so, as well as for Debbie and Phyllis's many contributions to the work of our roundtable over a number of years now. There are 6 members of the workshop planning committee. There are 6 other members of the workshop planning committee in addition to Debbie and Phyllis: Marquita Davis, Jennifer Fry, Jacqueline Jones, Valora Washington, and Paula Lenz, who is also a member of the roundtable. Debbie Chang is Senior Vice President of Policy and Prevention at Nemours, and Phyllis Meadows, who you'll see later in the agenda, is Senior Fellow at the Health Program at the Kresge Foundation. So without any further comments or from me, you will now hear from Debbie Chang. Debbie?
Thank you, George.
Thank you.